I am Nina Subotina from Buenos Aires, and I will speak about HBO, that is hyperbaric oxygen treatment, and COVID-19. COVID-19 deaths can be reduced simply and safely. What is how? Applying HBO treatment. HBO is hyperbaric oxygen, and HBOT, hyperbaric oxygen treatment. It is a very safe, non-invasive medical application which permits tissue oxygenation to be corrected. Here is a graph that shows that when oxygen plasma tension increases from 94 millimeter of mercury to over 2000 millimeter of mercury, breathing the patient inside the hyperbaric chamber of pure oxygen at 2.5, 2.888, what happens in the tissues? And in the tissues, the oxygen pressure increases from 40 millimeter of mercury to over 1,400 millimeters of mercury. Some published series have demonstrated the safety and efficacy of this treatment. In spite of advances in vaccination, the pandemic crisis of COVID-19 still hasn't gone away. At August 15th, more than 200 million infected by the virus were registered. Many patients are hospitalized, but without any substantial therapeutic breakthrough. So why not to use the hyperbaric oxygen? Here are the background and key aspects of COVID-19 pathology and pathophysiology to link them with the usefulness of hyperbaric oxygen treatment. First, SARS-CoV-2, the virus that causes the COVID-19 infection, causes severe respiratory disease resulting in hypoxemia and tissue hypoxia, exaggerated immune response with resultant inflammatory response. Other characteristic of COVID-19 is the coagulopathy, hypercoagulopathy, I would say. So cardiac, neurologic, and renal damage are common, also extremities lesions. With long-term hypoxia appears oxygen death. The progressive respiratory failure is the primary cause of death. Histological study of the lungs obtained from autopsy from patients who died from COVID-19 show it as pulmonary vascular endothelialitis. The corrosion casting showed microvascular alterations in lungs with architectural distortion. Panel A presents healthy lungs. Panel B, lungs injured by COVID-19. A great part of capillaries is affected. Besides of diffuse alveolar damage, you can see perivascular T-cell infiltration and severe endothelial injury, the presence of virus inside the cells and disrupted cell membranes. Also widespread thrombosis with microangiopathy. The alveolar walls are enlarged with multiple fibrinous microthrombi marked by arrowheads in the alveolar capillaries. Extravasated erythrocytes and loose network of fibrin can be seen in the intraalveolar space. There is an exuberant immune reaction. The virus invades the organism at angiotensin converting enzyme 2 receptor. It enters inside the cell and begins to replicate and release hundreds of copies of virus. This initiates the early phase immune response. And invasion of active immune cells into the lungs tissues results in overproduction of inflammatory and pro-inflammatory cytokines and chemokines, including inflammasomes, interleukins, interferon, tissue necrosis factor, and other substances. The hyperactivated immune cells are trying to eliminate the virus, and in this outrage produce damage to proper tissues. Finally, all the organs get involved. The ubiquitous endothelium, once being injured, leads to activation of proagulant response and multi-organ failure. Proagulant response is finished in thrombotic complications. Clinically, many patients have elevated D-dimer levels, as well as cutaneous changes in the extremities as a result of thrombotic microangiopathy. Pulmonary embolism and ischemic stroke, myocardial infarction. Many patients require invasive mechanical ventilation. Patients may develop acute renal failure, liver dysfunction, bleeding and clotting dysfunction, and septic shock. Part of the exaggerated immune response in COVID-19 is due to the neutrophil extracellular traps. Here they are in this graph. Also called by the first letters NETs. They contribute also to thrombosis development, as it's seen in this graph. Neutrophils are the main cells of the innate immune system, as they are able to trap and kill pathogens such as bacteria, fungi, and viruses. Internal membranes is break down, and they expulse the DNA fibers comprised of histones and cytoplasmatic proteins. It is therefore clear that the virus-induced netosis acts as a double-edged sword. There is the mechanical entrapment of virus, but the inflammatory and immunological reactions triggered by the release of the nets are harmful by themselves. The hyperimmune reaction is called the cytokine storm. Can hyperbaric oxygen safely serve as an anti-inflammatory treatment for COVID-19? HBO is safe and provides oxygenation, reduces the inflammatory response in pneumonitis by attenuation of innate immune system, increases hypoxia tolerance, and thereby prevents organ failure and reduce mortality. So HBO could be applied as an early intervention, utilized as the first sign of decline in oxygen blood saturation level, as well as in critically ill patients. Here are the mechanisms of beneficial effects of HBO in COVID-19. They were demonstrated by case series reports from Wuhan, China, that were the first studies. The condition of severely ill patients improved by increasing blood oxygen saturation levels and reducing lung inflammation, and decreasing the cytokine storm. The graph on the right shows the day-by-day increase of oxygen saturation levels. Here it is in this graph. In a published case series in Louisiana, USA, 5 patients that were candidates for intubation were treated with hyperbaric oxygen. Patient symptoms were rapidly relieved and they all recovered after 6 treatments without intubation and mechanical ventilation. HBO recovers the state of the innate immune system. It's important that macrophages change from the pro-inflammatory subtype to the anti-inflammatory subtype. Beneficial impact of hyperbaric oxygen on COVID-19. First, the oxygenation of tissues is restored. The harmful immune response is covered by a specific anti-inflammatory effects of hyperbaric oxygen on inflammasomes, pro-inflammatory and inflammatory cytokines and chemokines. What about hypercoagulation? One study demonstrated reduction in D-dimer levels, impact on oxygen debt. It is eliminated by restoration of aerobic metabolism in chronically hypoxic tissues. Besides, there is an effect on mesenchymal and hematopoietic stem cell, likely additional anti-inflammatory effect. In this graph, there are all the effects of hyperbaric oxygen treatment for COVID-19. The length of time during which patients can safely receive oxygen inside the chamber is limited, mostly due to oxygen toxicity. One of the threats for hyperbaric physician was to treat damaged lungs with high oxygen pressure. But recent studies, one is depicted here on the left and other on the right, have shown the safety of this treatment for patients with COVID-19. So the COVID-19 is a beneficial treatment. The first objective is to overcome hypoxia. Some patients, in spite of higher fraction of oxygen along with mechanical ventilation, cannot be well oxygenated. They need HBO. Here, before entering the hyperbaric chamber, here is the hyperbaric chamber in Russia. So there are many beneficial effects of hyperbaric oxygen. So this comments is COVID-19 deaths can be reduced simply and safely. It is the main objective of my presentation. COVID is associated also with other problems, with hearing loss, tinnitus, and vertigo. And these people can have like a double benefit because these problems are indications for hyperbaric oxygen. The same about the central retinal artery occlusion, which is the indication for hyperbaric oxygen, and other ocular findings. From the early time of pandemic, UHMS, an important source of scientific and medical information pertaining to undersea and hyperbaric medicine, was coordinated, evolving research and stimulating it. On June 20th of 2020, took place a webinar dedicated to this topic. The great advance was in the decision of the scientific committee of UHMS to accept as control group patients only receiving the standard therapy, but not breathing air inside the chamber, while generally the control group is formed by the patients that are subjected to breathe air inside the chamber. This decision helps to perform controlled clinical trials so necessary to officialize the HBO application in COVID-19. Argentina is ahead of the struggle against COVID-19. From July 2020, one of the northern provinces of Argentina, in one of the cities in Perico, there was installed a multiplex hyperbaric chamber in local hospital. Until now, more than 350 patients were successfully treated in this chamber. Guillermo Quintar, medical doctor, is one of these pioneers who are treating the COVID-19 patients candidates for intubation and mechanical ventilation inside the hyperbaric chamber. He reports a rate of mortality in moderate, severely, and critically ill patients that are much less than international values for the patients that were not treated in hyperbaric chamber. The overall mortality rate was only of 11%, and we should remember that were the patient candidates for intubation and mechanical ventilation. Conclusion and risk-benefit evaluation. HBO is safe, reduces the inflammatory response, and betters the oxygenation. What is very important, that nominal risks of HBOT, even for relatively sick patients, are less than the risk of intubation with COVID-19 pneumonia. Okay, why this promising method is not applied broadly? There is a need for multi-centric controlled trials to permit a broad application of HBO, because now we live in the epoch of medicine-based, evidence-based medicine. The prognosis of pandemic and post-pandemic transmission of SARS-CoV-2 was investigated in Harvard University. This investigation was published in April 2020. So they still not say about vaccination. And they say that if immunity to the SARS-CoV-2 is not permanent, it will likely enter in regular circulation. And now we know that the immunity to SARS-CoV-2 is not permanent. Low levels of cross-immunity from other beta coronaviruses would make it appear to die out the virus, but to research some years later. So, to shorten the SARS-CoV-2 epidemic and ensure adequate care for patients, the development of additional interventions are urgent priorities. One of these priorities is the treatment. Here are some graphs, very interesting, and on the basis of their research, they elaborated some scenarios. How will be transmitted SARS-CoV-2? Panel A, if the immunity duration will be 40 weeks. Each year there is a new wave. Panel B, 104 weeks. Every 2 years, a new wave. Panel D, long-term immunity duration with elimination of the virus. But very important, panel E, a resurgence of SARS-CoV-2 would occur as late as 2024 after apparent elimination only by the evolution of viruses. So what should we do to adapt to live in pandemic? So now, how to do the right things ethically regarding HBOT for COVID-19 pneumonia? Still now, it is off-label indication. What is the practice of medicine? Physicians can make case-by-case decision and to treat patients if they consider it necessary for the patient. But if HBOT is performed with the intent to apply potential findings to the care of other patients, the clinician is engaged in research. So institutional review board approval is necessary. The ethical principles are stated in the Declaration of Helsinki. A physician shall act in the patient's best interest when providing medical care, and an informed consent is strictly recommended. Here is my course of hyperbaric medicine sponsored by the Argentina Medical Association, and I have prepared an entire lecture about HBO and COVID-19. Thank you very much.